Let me start with where we are right now, the red setting. This is the place where case numbers are high and hospitalised admissions are also high, so we pop on the brakes. In particular, we have had measures like a gathering limit of 100 people, which applies to events in hospitality. After analysing our own data, we identified that hospitality, for instance, had a secondary attack rate of 6.7%. That transmission rate is relatively low, and this has been backed up by other research. And so, it is the view of our public health officials that we can safely increase these gathering limits indoors to 200 without having a significant impact on our health system and hospitalisations, especially given we will maintain our seated and separated rules for hospitality. The second area we have analysed is the difference between indoor and outdoor gatherings, and there is a difference. While Omicron is more transmissible, the natural ventilation of an outdoor setting reduces the risk significantly. At RED, we want to encourage gatherings and events outdoors. They're a way we can come together safely. And that's why, on the advice of our public health team, we are removing all outdoor gathering limits. Sports, concerts, gatherings outside without limit will resume. What remains in use at this level is, of course, masks. I know they are new for us and most people really dislike them for good reason, but they're so critical and one of the ways we can show care and respect for one another, including our immunocompromised community. Research published in the British Medical Journal late last year shows that mask wearing reduces new COVID-19 cases by 53%. Masks matter. That then brings me to Orange. We all remember there are currently no capacity limits, either indoors or outdoors, with the use of My Vaccine Pass. And masks are required indoors with some exceptions, like education. Having no capacity limit remains, but we do want to apply what we've learned. That's why we'll be firming up our gathering guidance for Orange. We know for indoor events, close contact is higher risk. So to help organisers continue to provide the safest possible environments, we're encouraging larger events that are over 500 to either add extra capacity in a venue or provide seating. And finally, green. This is very much an example of the new normal. There are no requirements or restrictions here, but there is guidance, and we'll still be in the system as a way of reminding each other that we need to be on watch, ready to move should we need to. So no changes here. And so, simply put, red means indoor gathering limits and masks, orange means masks, and green means guidance. These changes are based on the best available evidence we have right now in real time. We believe they will make the COVID protection framework easier to maintain while also still being very effective. The advice we have, therefore, is that they are changes we can make almost immediately and will come into effect from 11:59 p.m. this Friday, the 25th of March. This does mean from this weekend, sports, outdoor events can all resume and hospitality can increase its capacity, but of course they must maintain the seated and separated rules. You'll remember, though, that there is one element of the COVID protection framework that I haven't talked about yet, and that is the future of vaccine passes. Given the pandemic rollercoaster everyone has been through, it's easy to forget why we used them in the first place. They were first used by countries who were trying to move away from broad-based restrictions as vaccines became available. I remember not being in favour of their use. In fact, I am on record as having said that. But after several months of lockdown through Delta, it became clear that mandates were needed to achieve vaccination levels required for safe reopening, and that passes had a role to play too. It was a tough call, but mandates and passes were undoubtedly one of the reasons that we reached 95% of the eligible population vaccinated to achieve the near elimination of Delta over summer. But something has changed since we brought them in, and that something is Omicron. In the pandemic so far, we've had more than 500,000 confirmed cases of COVID, almost all of which have been in the Omicron wave. Many cases don't show symptoms, and testing doesn't catch every case. In fact, modelers say that total infections now could be as high as 1.7 million. The reality, too, is that COVID finds the unvaccinated, and for them, the illness can be severe. A significant number of the roughly 180,000 unvaccinated Kiwis are likely to have had COVID or may well in the future. Our vaccine pass system doesn't incorporate that into the way it works, but the outcome is the same. We now have 95% vaccinated, plus a number more who will have built some immunity from the illness itself. We said some weeks ago that when we started to come down off the peak, the reason for keeping vaccine passes changes. As this graph shows, that time is nearly upon us. In fact, you can see the predicted decline that ends on the end axis, which is for roughly the 5th of April. And so, from 11:59 p.m. Monday, 4 April, vaccine passes will no longer be required to be used as part of the COVID-19 protection framework. There will be some businesses, events or venues who may still wish to use them for their own reasons, and they can if they wish to do so. We will maintain the systems in place and update the passes over time to include boosters. But for now, they will no longer be mandated. I say for now, as I will still provide the same disclaimer that every country realistically must, that should there be a variant that demands it or a change in circumstances, we may need them again. But for post-peak, that will no longer be the case. There's one extra tool in our daily lives that falls into that category too, and that is QR codes. As everyone now knows, we have changed our testing and isolation requirements. The isolation period for both positive cases and household contacts remains at 7 days. While we'll keep that under regular review, there is no plan for us to contact trace more widely, with the exception of high-risk environments like aged residential care facilities or residential facilities for our most vulnerable. That means the reason for using QR codes changes. And so, from this weekend, you'll no longer be required to scan everywhere you go, and businesses are no longer required to provide the mechanisms to do so. We do have an ask for everyone, though. If a variant arises in the world that evades vaccines or is more deadly, contact tracing will once again provide a critical role. Please stand ready as business to stand up QR codes again, or as a citizen to pull out your Tracer app at a moment's notice. Don't remove the app from your phone just yet. Scanning has been a really important part of what we've achieved, so thank you for everyone for playing your part. But for now, we can all stop hovering around the entrance to a supermarket or venue while we stumble around on our phones. A welcome change for us all, I'm sure. Finally, as a Cabinet, we've also reviewed the role that vaccine mandates have played. You will recall we were always cautious about their use, applying them to education, health, police and defence workforces, border and MIQ workers, and those where vaccine passes were in operation. As vaccination rates increased, we reached out to Professor David Skegan, the Public Health Advisory Group, for his advice on their future use. Their advice was clear, stating, quote, "The case for or against is now more finely balanced. Because of our relatively high vaccination coverage and increasing natural immunity, as well as the apparent lowering of vaccine effectiveness against transmission of the Omicron variant. While vaccination remains critically important in protecting New Zealanders from COVID-19, we believe that several of the vaccine mandates could be dropped once the Omicron peak has passed," end quote. And so on that basis, and in line with the Public Health Advisory Group advice, the Government will not require mandates to be in place for education, police and defence workforces, and those businesses operating vaccine passes from 11:59 p.m. Monday, 4 April. Whether or not these workplaces will continue to need to be vaccinated to do their work will be a decision for their employers or those otherwise responsible for those workforces. We will continue their use for health, aged care workers, corrections staff and border and MIQ workers. The rationale in each case is clear. These are either workers supporting our most vulnerable, or they work in high-risk environments where spread would be rapid or the exposure to new variants is high. In continuing the use of mandates in these limited areas, we did, however, want to ensure they are used carefully. So we've asked for Health to come back with advice on whether the mandates applied in the health sector in particular, which covers thousands of workers, could be narrowed. We know that government were not the only ones also using mandates. In fact, many of the mandate examples I have heard used are those that were applied by the private sector. Given the adjustments we are making today, MB is working to update advice to the private sector on their use more broadly. Finally, I do have one message on vaccinations. Even though there is no longer a requirement for many, please get vaccinated and please get boosted. It is one of our very best tools. Every unvaccinated or unboosted person adds risk to the health of another. And with New Zealanders returning home from overseas and our borders shortly open to tourists, it's going to be even more essential to our recovery and protection against future variants. Being highly vaccinated will continue to be central to the strength and stability of our recovery. And so, as we move to this next phase, I have a couple of final asks. 2 years ago, we had very few tools. Now we have plenty. But one thing is still the same. We cannot do it alone, and it wouldn't work if we did. We're seeing businesses and workplaces show enormous agility by adopting infection prevention controls and testing to try and protect their workplaces. We're seeing schools do what they can to keep their kids and communities safe through changes in teaching patterns. We're seeing individuals who may have friends or family that are unwell or vulnerable taking tests and wearing masks to keep them safe. And most importantly, we're seeing thousands of people vaccinated every day to look after one another. As a government, we need to make sure we're supporting businesses, community and individuals to have more control in managing their health and well-being. Because managing a pandemic and supporting our economic recovery is going to take all of us. To keep each other safe, to keep our local businesses open and busy, to support our hospitality providers, to welcome back our tourists, and to support our recovery. But if there's one thing I know by now, it is our ability to do all of that. This is not the end, but in some ways, it is also a new beginning.